everyone, welcome back and thank you for still tuning in with us on the 3 Hour News Show. So we have come to the See the Story segment of the 3 Hour News Show. Before talking with our guest today, I want to ask you, Kai, do you have any relatives that have or a survivor breast cancer?
Yes, I actually do. Relatives and friends.
Oh, yeah.
Yeah.
Well, actually, my mom is a survivor, so
That's right.
yeah, because I need to get ready for that as well. As they say, if you have a mother who has cancer, especially breast cancer and cervical cancer, it goes down to the
girls,
daughters. Yes.
So we must check as early as possible.
True. Okay, so did you know that there is an organization that gathers breast cancer survivors from across Indonesia? Let's see.
LOVEPINK Indonesia functions as an information hub and a support platform while offering services to inform of breast cancer to communities, schools, and other organizations. They also aim to lower the number of breast cancer patients and raise breast cancer survivability. They have various programs to achieve their goals, including the provision of 10,000 free breast screenings to detect breast cancer early.
So to know more about LOVEPINK Indonesia, we now have Dede Gracia and Anita Dwi from the community in the studio with us. Hi, selamat sore, good afternoon.
Evening, it's not a
Good evening.
Evening.
It's past my- Yes. Good evening, ladies. So tell us about this community, the LOVEPINK community. How was it founded? It was you who founded
No, actually, it's founded by Madalina Mutia and Santi Persada. So it was in 2012 during their treatment of chemotherapy. They meet each other and they feel like they can support each other. So after their treatment, they're like, this is a good idea. It's interesting to have support from the same experience. Yeah, so they wants to share it to others warriors. So after the treatment, yes, they reach out to the warriors and let's start make a LOVEPINK. So 2014, LOVEPINK. Yeah, 10 years, yes.
10 years.
Yippee.
It's actually the support, what they need. Right?
Correct. Yeah.
So why is it pink though?
Pink, it is actually a color code for breast cancer.
Oh, a color code.
Yes, it's a
ribbon.
pink ribbon. Yeah,
In the word, they use pink colors.
yeah.
Yes.
Pink one, pink ribbon.
So pink is always associated with breast cancer, I know, because purple is, for example, purple is lupus.
Yeah.
Yeah,
Something like that. So this is the really, really cool thing. I think that, this is something that a lot of women are really worried about in these days. And, I know you mentioned that if you have a mother or a relative, there's a risk factor, but I think it's been proven that in today's day and age, everything can become a risk factor,
correct.
right?
Yeah.
So can we ask about the statistics?
Statistics.
Here in Indonesia particularly,
Okay.
do we know the age range of now
Yeah.
and how many women?
Okay. Based on last year from a global cancer observatory, 2022, there is like in Indonesia almost like 30% population is get breast cancer. So if we have like 136 million women, over 66 million.
So
have
30%
breast
of the entire female population.
Yes, female population, yeah? Yeah, that's based on 2022. Yeah, and that's have a first rank from top 5 female cancer. After that, followed by the cervix and ovarian.
So the biggest amount of the cancer.
The cancer,
Yeah,
is
are
the
the
breast cancer.
Breast
Yes.
cancer. So, okay.
Women cancer.
Women cancer. Okay. We mentioned about support, but what do they actually need? I mean, to prolong the life as warriors or survivors, because they have to go through, chemotherapies.
Yeah,
They have to go
right.
through maybe the mastectomy and all that,
Yeah.
right? So according to your experiences with the community, what factors do they need the most? Maybe from the family side,
yes.
from the friends and from all aspects of life.
They need support for sure, because when the first we have diagnosed with breast cancer, we feel like that's our end of life.
It's a stop,
right?
there.
Yeah. That's why we need a support from our family. Then for the support from the community means we have the same experience. We can share our
Feeling.
our feel. We can share our experiences about if you have a same when we have a chemotherapy. You have a chemotherapy, something like that I was too.
Okay, so you have like sort of like you can share
Relatability.
Yeah.
But yeah, I just want to add a little bit though, Kai. I mean, my mom, she didn't even know that she had breast cancer before. That's why it was like a shock, right, to everyone. So how do you actually reach out, women out there? I mean, women from younger ages as well, right? I mean, they have to make sure that they have the checks and all that, so that they are ready for that. You know, the ages, what can you recommend, let's say for women in their 20s or women in their 30s? How often do they have to have the checks?
Okay, first of all, actually, we started like 30s, but now our campaign is moved to like younger, earlier, about 17. So that's why we reach like high school, because lately we found out that in one of the hospital, a girl 17 years old, they already have a breast cancer. So now we are doing sendiri, periksa payudara sendiri. We have an app, so you can download, they can check. So monthly, every month after menstruation, you have to be like used to be a habit to check every month after your menstruation.
What kind of check? I mean, do they have to check the
we have the way, like you just
how to
do it.
How
you have to
sendiri and the right time to check, the right time that we sendiri, something like.
So when would the right time be? Because I know that at certain times of the month, this is why this is so female specific. We feel aches in our breasts, right? So you mentioned before, is it after the menstruation finishes?
7 to 10 days after the menstruation.
So during the middle ovulation phase?
I don't think it's not really precise, but because sometimes we have women always have a hormonal, So the best is day 1 after 7 to 10 days menstruation.
Means like you have a menstruation in 1st of July, mean you have to do the sendiri the 7th in between 7 and 10.
Oh, right. 7th to 10th of July.
Because you know when you're PMS, you start feeling pains again. That's something completely different. Yes. I love that we get to have these conversations, because I feel like, you know, we live in a society where women are not encouraged to get to know their bodies. And this is such a female-specific, you know, disease. My question would be, how, because you're now doing programs to as early as 17 in school children. What do you see in communities? How important is it to be able to be self-aware of your body in order for you to be able to detect these female-specific illnesses? Because you have to know your own body, but most of us are not raised to be able to know our own body.
So actually, Nita LOVEPINK have a program, socialization. We call it Pink Talk.
Pink Talk.
Yeah, Pink Talk. All is pink. Pink Talk, Pink Fan. We have Pink Fan, you know, and we have
Pink Screen.
Pink Screen, and the new one is Pink Story podcast, because I think it's more easier to deliver the message to the youngest one, because they like to see YouTube. So that's easy to digest, and through that socialization, they know how to get
the socialization means we share our knowledge about early detection about breast cancer and breast screening. And the second one, we have a support moral.
Moral support.
Yeah, moral support that to the patient and their family.
And the family as well.
Yes.
That is very important.
And we have a caregiver, right?
Yeah, we now
LOVEPINK
have a caregiver group. So sometimes if we have a family with a cancer, we don't know what to do.
Yes.
Right, so we
Yeah.
provide that. So you can ask the team of caregiver to give an advice what to do, and because the emotional mood will be like changing all the time.
Ups and down.
Exactly.
And just now you're asking about how to reach that.
Yeah.
Yeah, that's actually we have gerakan 10.000 USG gratis.
Oh,
USG,
it's a free
USG.
USG.
Yes.
Free USG.
USG, yeah.
Okay. What about people out there with less internet connection, like in the remote areas, for example, where they have females as well, or maybe younger females, teenagers? How do you reach them?
Yeah. Actually, for
To reach. Yeah.
for like in a suburban or that the remote area is quite hard. But sometimes we have working together with the clinic to get this breast check for
Yes,
Clinics
something
as in puskesmas, you're saying?
yeah puskesmas. Yeah.
Ah, right.
We join with them, and then sometimes we go to like rumah susun to reach those people. We working together, and we also have a pink van, prestige van that we can bring to some remote area. But it's like limited. Yeah, we only can
15, about 15.
do it for 15 people only.
Oh, 15 people.
Yeah.
So after having gone through all these programs, I know that you must have met a lot of warriors and survivors here in Indonesia. What would you say were stories? You also mentioned a lot of mental up and downs and facing society, even your family, if you have if you have been diagnosed with a debilitating illness, is very, very difficult. What kind of stigmas do you see that warriors and survivors had to fight against, and what was your advice after having perhaps overcoming them? Would you give to those people who are still fighting and surviving?
Yeah,
We have
pink top.
yeah,
Pink squad.
Pink squad. We have a pink squad.
All
pink.
all pink squad.
And by the way, I love the pink socks as well.
Yeah, the pink socks are very cute.
Actually,
That's
usually
nice.
black. Now is have a pink here.
Yes.
Yeah, we have a pink squad. Pink squad means something like us. We already passed all the treatment. Then we giving back to our community. That we share our knowledge about what is breast cancer. Then we actually more support more or something like that, because that's we really need that one.
What kind of stigma exists though in regards to breast cancer?
Sometimes like negative stigma is
Yeah.
like, oh, I've got a curse from the family, or maybe like I have
sinners or
I'm a
something.
sinner, so I have this breast cancer kind of things. But in fact, in medical theory, there is no such like why we get a cancer, because sometimes it's like the environmental and can be a gene, and also a lot of things that we don't know, because even one of our member, they eat healthy, like to do sport, and when she got breast cancer, she shocked.
She got shocked, definitely. Yeah, I mean, all of us has cancer. It's just a matter of.
But then
whether it's
this
activated or
communities really help a lot,
Yeah.
I mean,
We feel not all alone to
Face the reality.
that's the reality, yeah.
Oh, wow. Okay. This
Well-
is getting deep.
Yeah, of course. Because we're going to continue to talk about success stories and what success would look like for LOVEPINK community after the short break. So make sure you stay tuned and don't go anywhere.